Hey guys, Dr. Josh Jagoda here, and today I am going to show you how to alleviate a lot of knee pain, including knee pain that arises from what we call patellofemoral syndrome. And a lot of times what we do is we have a lot of kneecap issues, and we have a lot of this compression of that kneecap, which compresses the patellofemoral or the patella tendon, and that's where we get the patellofemoral syndrome. And so the kneecap moves in multiple directions. It goes up, down, left, right, and diagonal. It goes circular. So what we want to do is mobilize that kneecap. And so I'm going to show you just by relaxing my knee the best you can on a ground or a hard surface, and I'm going to kind of encompass just like this type of grip right here. And I'm going to glide and slide that knee up and down the best you can. Try to relax your knee the best you can. Go side to side. Just be wary of going out that way to the lateral side or the outside of the leg, because the most likely way for the patella to dislocate is laterally. But and if you've had some of these issues in the past, you'll know what I'm talking about, because you probably won't want to do that. But you want to make sure you can push and glide and slide the kneecap left to right, down, up. You can kind of reinforce it, or you can do circular patterns going one way, circular patterns going the other way. And I'm going to just show you a little bit like this. On this positioning right here, you'll just kind of come in this way, and I'm just taking my hands and I'm just gliding it like this. One direction, other direction, and I'm not really giving much. I'm actually forcing the patella to move on top of all the other structures. And if I find that restriction where it's like not really going one way, now, and I can tell that my knee doesn't really go that way as much, so I'm going to just push and maintain that hold for a little bit. Again, we're not really shoving it where the kneecap actually kind of comes all the way over here. We're just allowing some mobility, just like a stretch. You wouldn't just, stretch your arm and just go, ah. You would really hold that stretch and allow some gentle give within that stretch, really effectively stretching that muscle, right? Same thing here. You want to effectively mobilize, but you don't want to overdo it. So that's why I like this position, where you really get that, but when you really start to reinforce, you really add a lot more depth to that mobility or that mobilization, and that's where you have to weigh that cost-risk benefit ratio there, because you want to mobilize, but you don't want to do too much where you're now having other issues. But this is a great way to help people with patellofemoral pain, or pain that is really at the bottom, like patellar tendinosis, patellar tendinitis. This can really effectively help that type of pain and help that mobility. Alright guys, I'm Dr. Josh Jagoda. Thanks for stopping by, and don't forget to subscribe to our channel. So we will see you guys next week. Bye.